Video content or information here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Please also see the written disclaimer with more details below. Thank you. Hi, I'm Dr. Carrie Bennett, and I'd like to talk to you about the four-letter word that's in cancer therapy and breast cancer, and that is wait. W-A-I-T, wait. I'm a therapist, and in my therapy practice, we use wait to say, why am I talking? But in breast cancer, wait is the four-letter word. People get breast cancer, and the very first thing that happens is they go into massive fear. They go into the grief reaction of mad, sad, bargaining, denial, acceptance. Trauma from other people that they've known with cancer comes up, and everybody is afraid and comes in and says, I want my breasts off. I don't want to wait. And then we slow things down, and with most people discuss the fact that taking their breasts will not change their chances of the cancer coming back, nor will it change their survival rate. Most people with breast cancer nowadays have 100% survival, and taking the breast does not increase your future risk of breast cancer, your future risk of breast cancer. People say, how can that be? If you take my breasts, how can I get breast cancer again? Well, the reality is that we think, and this is all theoretical, we have things called stem cells. So just like if we take out the uterus from someone, even though that's the only place in the body that endometrial tissue is supposedly existing, you can take it out and people can still get endometriosis within their abdominal cavity and even their nose. We think that's because we have these pluripotential stem cells, that is, cells that can become anything. When we take the breasts and do a full mastectomy, one of the things that people need to know is, yes, the surgeon might leave cells behind. And currently, through the American Society of Breast Surgeons, they're trying to initiate a study to look at how much breast tissue is left behind. We theoretically, and we certainly wanted to take all the breast tissue, but are we really? And that is not something that's been studied yet. The other piece is, if we are taking all the breast tissue, which we have believed we've been doing, how can that happen? Well, it's those pluripotential stem cells. And what we can say from studies from the 1970s on that are very powerful studies, that is, studies that have many, like hundreds of thousands of people in them, what we know for sure is doing a partial mastectomy, often with radiation if you're less than 70 years old, or without radiation if you're over 70 years old, the survival rates and the recurrence rates are exactly the same with saving your breast with the partial mastectomy versus taking the full breast. Another factor here that I like people to understand is there are some genetic factors which may need to be taken into account, because BRCA patients will have a risk reduction with a full mastectomy. But really at this point, and this is 2024 that I'm giving this talk, those are really the only patients who will benefit from mastectomy, other than people who have disease all over their breast in multiple areas, or people who may have received full breast radiation previously with a breast cancer. Although in that latter stance, where people have had breast cancer with full dose radiation, we are now finding the survival rates and distant recurrent rates are also the same with a partial mastectomy and maybe some local radiation. So it's really important to have your disease looked at with the doctor or clinician and the team of medical, surgical, and radiation oncologists to help you decide that. But this talk talked about wait. Waiting is because it's not an emergency. We can leave that cancer in based again on very powerful studies for likely 6 months, and it would likely not change your management. Certain things like growth rate may affect this. Certainly if someone has what we call a Ki-67 rate, of a proliferation rate or growth rate that's very high, that might be less so. But people with moderate or low growth rates, we have a bunch of data to show that likely leaving the cancer in for 6 months will not change your outcome. There's also data to show that if you wait a month or so after diagnosis, that patients may have better outcomes. We believe that that's because people get out of that shocked, sympathetic surge of fight, flight, or freeze, have better blood flow, be able to cope with the mental and emotional aspects of getting their diagnosis of breast cancer, which are usually far much harder to take, the mental and emotional aspects of breast cancer, than the physical aspects. The physical aspects actually are much easier and surprising to patients because it's almost like a minimally invasive type of surgery that you're not hospitalized for. But the waiting is the hardest part. I think there may be a song about that. But waiting, often every step of the way with breast cancer, first there's the diagnostic phase and then there's the treatment phase. The diagnostic phase may require mammogram, ultrasound, biopsies, possibly an MRI, possibly genetic testing, possibly other types of biopsies. If we see something like on an MRI, or checking your lymph nodes and doing a biopsy on those. And almost every step of the way may take a month in between. And that can be very difficult for patients, which is one of the reasons that I offer to every single patient who's diagnosed with breast cancer. I really suggest they get some kind of support with a therapist, coach, or some type of spiritual advisor. You have to be careful about using your friends and family only because they carry their own beliefs, their own trauma, and there's so much misinformation about breast disease and breast cancer. So it's very important to realize that once you get diagnosed, it's not an emergency. The days of rushing to the OR and whipping tumors out, we found actually hurt more people than helped people. We need to methodically figure out what we need to figure out with you, and then figure out the best forms of treatment. And then treatment, often there's a month between each stage. So after surgery, if the next step is either medicine or radiation, it'll be a month after the surgery likely before that medicine or radiation is started. And then after those are complete, the next step may take a month. So one of the hard things for people to realize is once you get diagnosed, it can take even up to a year to complete that initial diagnostic and therapeutic stage. Even for more very smaller, straightforward kinds of cancer, it would likely be a month at least from the time of diagnosis to surgery, and then often another month, and that would help you emotionally and mentally and get into a physiologic state, which is much more helpful to you and does not appear to be dangerous in any way. And then after surgery, another month before the next part of therapy happens. So we have great empathy about the fact that the waiting is the hardest part, which is we joke about it being the 4-letter word. But I want you to know that when you've been diagnosed with breast cancer, it almost always is not a surgical or medical emergency. The only exception might be inflammatory breast cancer, where we really want to start chemotherapy within a week or so of diagnosis to help, because it is a more aggressive type of tumor. But I want you to understand that when you're diagnosed with breast cancer, you can take the time to make a good decision for yourself, make sure that you and your clinicians have all the data that you each need to individualize your treatment. And we have great empathy that waiting is really difficult. So use that time to learn to walk outside for 30 minutes every day, which will help give you a very good, hopeful reduction in your future expression of cancer and help you get healthy. So that's what we want to talk about. Waiting is difficult. We have empathy about it. So exercise and get support is the best way to deal with the waiting. And also ask questions. Thank you.